is Tamara. I'm going to be performing an assessment on my mom. Here, do I have your permission to do this?
Yes.
Okay, and record. Okay, perfect. So we're going to get started. We're going to be doing abdominal, musculoskeletal, and neurologic exam on you. So we're always going to start with a general exam. So looking at your appearance, you're well-groomed, well-dressed, and your face is symmetrical, skin color is normal for your ethnicity, and you're in a pleasant, happy mood today. So we're going to go ahead and start with the abdominal assessment. So lay down, please. Okay, perfect. And I'm just going to pull this up just for your exam and pull this down just a little bit. Okay. Perfect. So we're going to start with inspection. So your abdomen is flat, it's non-distended, symmetrical, and there's no visible peristalsis. So with that, I'm going to go ahead and take a listening into all 4 quadrants. And they're all normal active. I'm also listening to the abdominal aorta, which there's no bruits, listening to the renal arteries, iliac arteries, and same thing, no bruits. So now I'm going to go ahead with light palpation, seeing if there's any pain. Any pain?
No.
Okay, so no pain or tenderness noted, which is normal. So I'm now going to go ahead with deep palpation, feeling for any masses, and while I'm here, I'm also going to feel for the liver border, which is not enlarged. Same thing here, feeling for the spleen, which is not enlarged. No masses here, no masses here. Now I'm going to feel for the right kidney, and it's not enlarged. Left kidney, and it's not enlarged. Okay, so that's the palpation. Now I'm going to be doing percussion. And it all sounds normal. And then from there, you're good with the abdomen. So, you can sit up. And then now we're going to be looking at the upper extremities. So we're going to do inspection again, looking at everything, making sure that it's symmetrical. So your shoulders, your clavicles are symmetrical, and your arm length is also symmetrical. So now I'm going to go ahead and palpate, feeling the clavicles, feeling for any lumps or bumps in the shoulders and in the scapula. And I'm also feeling the joints too while I'm here. Any pain?
No.
Okay, and also don't feel any masses. So now we're going to go ahead and check your range of motion for your shoulders. So I'm going to ask you to raise your hands above your head and then bring them down slowly and then cross in front. And any pain when you're doing that?
No.
Okay, so perfect. So that's your shoulder range of motion. So then I'm also going to have you look down and up, left and right. Okay, and we're going to do that again against pressure. So put your hand, yep, and on the other side, and down and up. Good. And then I'm going to ask you to shrug your shoulders. So, and then down, and then go ahead and do without, just by yourself. Good. And then we're going to check your biceps. So do a curl towards your face, up towards your face. Good. And then push down. Perfect. So your upper strength is good and equal, and your range of motion is also equal with no pain. And then now we're just going to be feeling for your pulses. So we're going to feel your radial pulses right here. Got it. And then your brachial pulses. I'm checking, feeling good. They're equal, +2. And then we're also going to be doing your reflexes. So we're going to check your bicep and brachioradialis. Same thing here. Bicep and brachioradialis. We're going to check your triceps right here. Okay, And then this one, relax. Okay, perfect. And then we're going to take a look at your hands. So they're symmetrical, no nodules or masses. And then flip on the other side, same thing. They're symmetrical, no nodules or masses. And then I'm going to ask you to squeeze my hands. Squeeze them tight. Good. And then I'm going to ask you to go up and down with your wrist. Any pain when you do that?
No.
Okay, and then go against my hands. Up and then down. Good. So that's done with the upper extremity. Now you can go ahead and lay back down. And we're going to take a look at your lower extremities. So we're going to be feeling for your hips. And they're symmetrical, and any pain? Okay, good. And then we're going to check your range of motion and your strength in your hips. So first bring your left knee to your chest. Good. And then down. Now you can do it against my hand. Push, push. Good. All right, relax. Now right leg, knee to chest, and down. And then do it again against my hand. Good. So it's symmetrical and you have good strength bilaterally. So now we'll take a look at your legs. Same thing, starting with inspection. Everything looks symmetrical. The leg length is symmetrical. There's no bowing or anything like that, so that's good. So then we can go ahead and start palpating. Any pain when I'm touching?
No.
Okay, and I'm not feeling any bumps or anything like that. So everything feels good. And then from here, we're going to check your knee strength. So I'm going to have you just lift up your foot. Good. And then just go up. Perfect. Relax. And down. Now check your knees on this side against my hand. Good. And then up. Perfect. Now you can relax. Now we're looking at your feet. Make sure I can see. Now we're looking at your feet and inspecting the lateral malleolus, medial malleolus, plantar, calcaneus, and any pain when I'm touching?
No,
Tenderness?
not at all.
Okay, good. So now I'm going to check your dorsiflexion. So point your toes up, and plantar flexion, point your toes down. Good. Now we'll do the same thing but against pressure. So lift your toes up. Good. And then down. Perfect. And then we'll check your inversion. So roll your feet in and then roll them out. Right. Perfect. So that's good. And now you can go ahead and sit up for me, please. So we're going to be checking your pedal pulses. Me checking your pedal pulses right here, which they're good. They're +2 bilaterally. And then I'm going to be checking your reflexes. So we'll start with your Achilles. Okay. And right here. Perfect. And then we'll check your plantar reflex, your Babinski. There. And then this one. Okay, good. All right. So that's it for that one. And now you can go ahead and stand up and then face the wall. Okay, so now we'll check your spine. So looking at it, it's all symmetrical, and I'm gonna ask you to stand back a little bit and then touch your toes. Okay, and then I'm feeling your spine here, and it feels good. There's no any curvature to it. It's straight and no bumps or anything, so you can stand back up. Okay, and then you can go ahead and sit back down. So that's done with the musculoskeletal. And then we're going to do our neurological now. So starting off with cranial nerve number 1, we're going to test your odor, your sense of smell. So go ahead and close your eyes. And I have this for her to smell, and you just got to tell me what it is.
I don't know what that is.
Guess, sorry.
Cinnamon?
Yeah, you can open. Yeah, it's cinnamon. All right, perfect. So now, all right, so now we'll test cranial nerve number 2, which is your optic field. So obviously you gotta keep your eyes open for this one. Just stare at my nose right here, and I'm gonna put some fingers up. You check your periphery, and you just tell me how many fingers I have up. Okay. So stay right here in my nose. Okay.
2, 3, 1, 2.
Perfect. So you got all that correct. So that's cranial nerve number 2. And now cranial nerve number 3, we're going to use this light here. So we're going to be checking your extraocular movements. So we'll use the light in a second. So I'm just going to have you stare at my finger right here. We're going to test your convergence. So I'm going to have you stare at my finger. I'm just going to go close to your face. So keep looking at my finger. Yep. And perfect. And then follow my finger. Perfect. So no nystagmus. And now I'm going to take a look at your eyes. Keep looking at my finger right here. Okay, so your pupils are equal, round, and reactive to light. And then the last thing we're going to do is check your blink sensation. So I have this little cotton ball here. I'm just going to put it at the corner of your eye, and it's just going to test that reflex that you should blink. So just look right ahead for me. Yep. Try to open your eye a little more. There you go. Got it. All right. So that one worked well. So now we're going to test, so that was testing cranial nerve 3, 4, and 6. Now we're going to go back to 5. And then 5 is testing your facial sensation and your masseter. So
Close my eyes.
Yeah, close your eyes. And just tell me where you feel the sensation.
My cheek.
Which side?
My left. My right cheek. My forehead. My nose. My chin.
Okay. So that's facial sensation. Now, can you go ahead and chew? Open your mouth, close your mouth. Perfect. That's good. And then we'll do cranial nerve number 7, which is facial movement. So raise your eyebrows and scrunch your eyebrows, make a happy face, and make an angry face. Perfect. So that's cranial nerve 7. And then we'll move into cranial nerve 8, which is a hearing acuity. So we'll just do the whisper test, and then if this were to be having an abnormal result, then we would do a Rhine and a Weber test with the tuning forks. But I'm just going to say a word in one ear, and you guys tell me what it is. Okay? So I'm going to cover this ear, and you're going to use this ear to hear it. What was the word?
Cat.
Cat. You got it. And then this one. And then this one. Oops. And this one is bird.
Bird.
Bird. Perfect. Okay. And then 9 and 10 is going to be palatal moving and swallowing. So I'm going to have you take a sip of this.
Water.
Okay. Yep. Just make sure that you're able to swallow it.
Okay.
So that's perfect. And then cranial nerve number 11 is your trapezius and sternocleidomastoid. So I'm just going to have you draw your shoulders again and relax. And then we'll do it again against pressure. Shrug your shoulders and relax. And perfect. And then the one after that is going to be the last one, cranial nerve 12, which is tongue strength and movement. So just stick your tongue out as far as you can and move to the left and to the right. And that's it. Perfect. So we're done with that. So now we're going to be doing a little bit more. So we're doing rapid alternating movements. So what I'm going to have you do is with your own finger.
Mhm.
So bring your finger up, whatever hand you want to use. I'm going to have my hand moving in different spots.
Mhm.
You're going to go to my finger, to your nose,
Okay.
back to my finger, but
Okay.
you have to follow my hand.
Okay.
Okay? So go ahead and start in your nose.
Oh.
Nose, finger. Keep going back and forth. Mhm. Mhm. Back to your nose, finger, nose, finger. Try to go a little faster. Nose, finger, nose, finger, nose, finger. Perfect. You did good. Okay. And then for this, we're going to do a heel to shin test. So we can do this like this. So you're just going to bring your heel to your knee, back down and up. So use your heel instead of your toes. Yep. And then same thing. Try to extend this one as much as possible. Yeah. Perfect. So do the other one just to make sure you got it. Okay, perfect. So you can stay sitting like that. And then we're going to be testing your superficial pain. So we're going to have a sharp object, which is the tip of this pencil, and a dull object. And you just got to tell me if it's sharp or dull. Okay?
Okay, close my eyes.
So, yep. So this is the example of the sharp. This is the example of the dull.
Mhm.
Okay? So keep your hands out like this, and you just tell me if you feel it sharp or dull. Okay?
Sharp.
Mm-hmm.
Dull.
Mm-hmm.
Sharp.
Mm-hmm.
Dull.
Perfect. So that's superficial pain. And then now we're going to be doing temperature. So I have a hot item and a cold item. And close your eyes. And now you're just going to tell me which one do you feel, hot or cold?
Cold.
And which one's this?
Cold.
You want to try again?
Hot.
So which one is this one? Hot or cold?
Hot.
Hot and
Cold.
cold. Perfect. Okay. And then we're going to be doing proprioception. So I'm going to have you stick out a finger. Close your eyes. Tell me what direction is your finger moving?
Up. Down. Side.
Which way?
Left.
Uh-huh.
Right.
And we'll do the other one. Other hand.
Up. Left side. Right side. Down.
Okay, so that's proprioception. And we're going to do vibratory. So you're just going to tell me if you feel it vibrating or not. Okay?
Okay.
So again, close your hand or close your eyes and just tell me when you feel it. Okay?
I can feel it. I can feel it.
Okay, good. So you feel it vibrating?
Mm-hmm.
Okay, perfect. Okay, and then we're going to be doing stereogenesis. So I'm going to have you stick your hand out and then close your eyes. And then we're going to have an item. Keep your eyes closed, and I'm going to put an item in your hand, and you got to tell me what it is. Okay? And you can feel it.
A spoon.
Mm-hmm. Perfect. And that's it, just the one item.
Okay.
And then the next one is graphesthesia. So I'm going to be writing something on your hand, and you just got to tell me what it is. Okay?
8.
Mm-hmm. And we'll do the other hand.
C.
Mm-hmm. Perfect. Okay, and then from there, we're going to do 2-point discrimination. So I have this paper clip here that has 2 points on it. You just got to tell me if you feel 2 or 1. Okay? So we'll start off on one side.
Keep my eyes closed, right?
Yeah, keep your eyes closed.
1.
Try again.
2.
Mm-hmm.
1. 2. 1.
Okay, good. Okay, and then extinction. So I'm going to be tapping on your shoulders.
Mm-hmm.
You have to tell me if you feel it in the left are in the left, in the right, or both?
Same.
Okay, with your eyes closed.
Okay. Both. Left. Both. Right.
Okay, perfect. So that was extinction. And then now we're just going to be doing the last part, which is the standing portion of the neuro exam. So you can go ahead and stand up. And then I'm just going to ask you to close your eyes and try to stay balanced with your feet close together. Put your feet close together. Yep, and then try to stay as still as you can. Just do 5 seconds. 1, 2, 3, 4, 5. Okay, we can relax. And then I know this room is kind of small, but we're going to do a little walking test. So just go from this corner to the night table. Just walk normal. Yep, and on the way back on tippy toes. Okay, and then on the way back on your heels. And then on the way back do heel to toe, like a, yep, sobriety test. Okay, perfect. So you can stand right back here in the middle. And then the last thing that we're going to do is the pronator drift. So I'm going to keep your hands prone out toward in front of you. And then you can close your eyes. Just don't let your arms drop for 10 seconds, okay? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Perfect. All right, and then that's it. Good job. Thanks. All right.